So our next speaker is Anna Barker, a professor at Arizona State University, where she is also the director of the Transformative Healthcare Network and the Complex Adaptive Systems Initiative.
Good morning, and thank you very much, Joe, for convening this meeting. I think this may be, you have meetings that you will remember. I hope you remember this one, because I think the slide you saw just before, I think maybe from Sherry, we are at a convergence in science. And it's interesting to talk about the question that was raised early on about, you know, what happens to these kinds of initiatives. We can't create these initiatives and then as interludes and assume that the world will go back to the way it was, obviously. So we have to, as a community, we have to figure that out. I've been very fortunate in my life. I am a convergence example, I suppose. I started at a university, went to a nonprofit for many years, spent a lot of time in the private sector, went to the government for almost a decade. I was the deputy director of the National Cancer Institute, and then back to a university. So people might wonder about my sanity somewhere along the line, but it's very interesting now to see that this whole initiative we call convergence isn't just going to be interdisciplinary. It's not just going to be transdisciplinary. It's going to be transsector, and I think we also heard that because, as you just heard from the previous speaker, the government is not going to be able to solve all these problems. We're going to have to solve these problems with other kinds of funding and I think with ideas that actually bring the entrepreneurial spirit that Bill talked about this morning to the fore as well. So I consider this a global problem, not just a U.S. problem, not just a European problem. So I think we have to sort this out in ways that we begin to learn not just from what we're doing here, but also what's going on in the European Union, as well as some of our Asian colleagues who seem to be able to learn from us and go do it much more quickly than we can. I don't know why that should be true. I do believe that we are facing probably some of the grandest challenges we've ever faced. And I do believe as we hear more and more about how we have to bring more relevance to what we do in the biosciences, that that's going to become an increasingly important factor, especially as we think about federal funding for cancer research. So I wanted to tell you just a little bit about a couple of things. I'm not going to say much about what I did in the government, but I had the opportunity to do some remarkable things there. I was able to set up the Nanotechnology Alliance for Cancer, Physical Sciences Oncology Centers, the Cancer Genome Atlas with Francis Collins. All of those are programs that actually brought large networks together. Now, what we're hearing mostly today is all politics is local, and you know we're hearing about some of these initiatives that are done on our various campuses. But ultimately, we have to figure out how to connect these communities. I learned a lot from those initiatives, some very positive things and some very negative things, but I have to tell you none of them were easy. And it's hard work to do this kind of research, and people have to want to do it. So I went to a university when I left the government that I thought could actually enable what I wanted to do in my next life. And so I think we need to think about what an organizational structure has to look like to enable this so that we don't come back to the question that was asked earlier. How do you know, if it's an interlude and you have to go back to doing things the way you always did them, then, you know, you really haven't achieved very much. So some of the things that we need is a committed and supportive cadre of leadership at the top. And if you don't have that, I would argue that, you know, things will become an interlude. And you need a silo-free, very fluid organizational structure. Now, that's pretty antithetical to a lot of our institutions. And those of us that know that and have tested that, you can change it, but it takes time and you have to have patience. We need policies. This is where we're still falling down. Promotion, salary, credit, those are all key words to people. It's the way they pay their mortgages. It's the way they get promoted. And, you know, are we making progress here? It's in the nano space if we're making progress, but it's still very much a huge issue, and my colleagues and I always have this discussion. And when I was at NCI, we had a lot of conversations with university presidents about this. They vowed to do something about it, but went back and had to face their faculty senate and realized it wasn't a simple thing to change in terms of tenure especially. You heard from Carla, we need startup funds for these kinds of activities. If you don't have startup funds, you have to depend on raising money from the outside, and without any demonstration projects, it's very difficult to do. The other thing is this is going to involve a lot of network partners, and enabling agreements and legal agreements and IP agreements. These are things that stop everything. And if you can enable this kind of work by getting that done, you know, I keep arguing that we need a global informed consent in medicine. Will we live long enough to get there? I don't know. But it's the kind of thing that we can do something about. Systems, you've been reading in the literature recently that a lot of our data in biomedicine is not reproducible. Is anyone surprised? No. Many of us have been saying this for a long time. And so when you're trying to put these large networks together, people have to have standards and best practices so they can compare results across these kinds of experiments. And you would strive for reproducibility, obviously, in certain areas. I don't think everything necessarily is going to be reproducible. That's another conversation. You need a program management culture. Again, antithetical to most of our campuses, but these are big programs that require that you know how to manage big programs. You need an interoperable IT infrastructure. You have to connect people. Again, everybody has their own system, very difficult to change, and you need several core foundational common resources, as you saw from the last talk. So I'm going to say a little bit about Arizona State University. It's a very unusual place, I should tell you. Why is that? There's a force of nature at the top of Arizona State University called Michael Crow, who went there in 2002 with an intent to create a university that is the new American university. And what that means to him is it's relevant to solving the world's problems. And he went there in 2002. I knew him at Columbia. I didn't think he'd last because the first thing he did the first 2 years he was there is he dissolved all the departments and set up schools and initiatives totaling around 33. I think the chemistry department survived, so those that trained as chemists, I think that's pretty much the single department that survived out there, maybe one other one. But essentially, the organizational structure there is dedicated to knowledge building and to what he calls use-inspired research. So that means that he's interested in relevance, and that doesn't mean you can't do basic research. There are lots of basic researchers there, but the university overall focuses on things like sustainability. And we have institutes like Biodesign Institute, which was formed by George Post and his colleagues, about 500 people in that institute, that use biological principles as a way to solve problems in other fields as well as in biology. So very non-traditional kind of place. The focus is on outcomes, and traditional research structures are still in place. I mean, we have classic academics who get R01 grants very successfully, but actually these larger network programs are really focused at the top. Very problems-oriented place, and Biodesign's a good example of that, as I said, about 500 people working across fields. Sustainability is a transdisciplinary platform. Complex adaptive systems is the one I'm going to say a little bit more about as an organizational construct for how you organize science and how you do science and how you ask questions. It's an entrepreneurial environment. There's a fair amount of risk capital from the president to actually invest, as near as I can tell. If you can dream it, you can do it. It doesn't matter if you're an undergraduate or a graduate or a faculty member. He's actually very interested in startup ideas for transdisciplinary convergence kinds of concepts. There are unique spaces there, like Decision Theaters, Origins, which is actually Lawrence Krauss actually organizes that. He brings a lot of public in to talk about how you do the kind of science we need to do today, and the Beyond Institute, which is headed by Paul Davies. So these are interesting examples of spaces that really enable the kind of talking that needs to be done to really enable convergence. Mostly, though, ASU takes professors out of silos and puts them into institutes and centers and schools to actually share their insights in different ways. They also, the students actually self-organize their something called Ignite. They hold their own meetings with the public and come up with ideas that they can actually apply, for example, to the National Academy of Engineering. I was at that meeting last year, and it's amazing to see what these students can do on their own. So I'm going to say a little bit about the Complex Adaptive Systems Initiative, which I co-direct there with Sandra Vanderloo and George Post. But just to remind you why in biomedical sciences we are so interested in complex systems, because these are self-organizing systems. They co-evolve with the environment. You'll recognize all of this because everything that we pretty much do in biomedicine today is a complex adaptive system. They're redundant. They demonstrate emergent properties, and they actually operate very far from equilibrium. That's important to think about the mathematics. And these are systems that learn over time. ASU is organized like this: biosocial sciences, biomedical sciences, decision sciences, and those actually are shown as separate boxes, but they're pretty fluid. And the cross-cutting kinds of cores here: evolution, evolutionary theory. I don't have it on here, but information theory, complex adaptive systems policy, and next-generation cyber capabilities. And to give you some idea, one of the things we're working on there is cancer. It's my area of expertise and a lot of other people at ASU. And this is an example of not just the fields that are involved that we think about in terms of cancer, but if you look across the bottom, this is all multi-scalar. And if you look at this, you start to see that we need to start to think about complexity in 4 dimensions, and I'm now talking about the 4-dimensional genome. Phil talked about the genome and the sequencing of the genome being critical. We now have to move to understanding the 4-dimensional genome, and that is, I think, going to help us to understand function and disease in ways that we can only dream about today. So I'm going to show you this picture. This is the Physical Sciences Oncology Centers network that I spoke about. So you can see some of your people, many of your people are in this network. We set this up at NCI. I show it to you because we learned an enormous amount from this activity and still learning. But these are some of the barriers that we've seen with putting this many people together to do convergence. And we had some of the same learning curves, Joe will recall, in our nanotechnology initiative, but it's culture, culture, culture. Respect for contributing disciplines is very difficult, and we think that should be inherent in the way we're all trained, and it isn't. And I think everyone doesn't have an understanding of everything. They don't have to learn everything. That's a very difficult thing for people to kind of get. Lack of common language. Why don't we work on convergent language? We don't, I should tell you. And then we don't understand what people can do in other fields for us technically. That's a very big shortcoming. And we view other science that we don't understand as irrelevant sometimes. This takes time. We're 5 years into this initiative, and I would argue that it'll take another 5 years to actually get the kind of common language we need. And you've got to have funding for these kind of things to support pilot studies, which we've actually done in that one. And it's commonly known biologists are mathematically challenged. And we have to figure that out and train more biologists in mathematics, but these systems are not at equilibrium that we're dealing with, so this is very sophisticated mathematics. And last but not least, we have no theories, right? I mean, there are no theories in cancer biology. There are no theories, I would argue, overall, save evolution. And I think it's very, very difficult for my colleagues to see the value of theoretical constructs for organizing ideas. I predict that theory will be one of the more important things that we actually attack in convergence in the next decade.